So the first session in TESA therapy is conventional tense. So sir, this is our conventional tense. This will be used in order to decrease your pain or reduce your pain and also to improve your quality of movement. So ang frequency na to is 80 Hz, ang intensity is 3 MA, and ang pulse duration is 30 ms. So we will be placing it in patients' posterior neck or specifically sa iyang upper traps and then sa iyang bilateral lower extremities, specifically sa iyang gastrocnemius. Sige. So sir, mag-start na po sir ha. Yeah, sir, I would advise you lang, sir, na di lang ta matulog sa ato the duration of our session. And then, if signal lang, sir, if you feel any abnormalities or discomfort, ha? So, na ko, sir, ito. So, using the parameters, magsugod na to, sir. This will go on for 15 minutes, okay? So, mag-start na ko, sir, ha? Okay. So, assuming that is done, so move on ta sa bilateral lower extremities ni patient, is, specifically sa iyang gastrocnemius. Sir, balik ko sa iyong legs, sir, ha? So, kung isa ka. Okay. Signal lang, sir, ha? If natin any discomfort. Okay. So, using the same parameters, sir, mag-start na po, okay? Ready? Okay. So, assuming that this minutes has done, so, tantawan na po. Sige, sir, suman na ta sa ato ang session today, sir, sa ato ang 10. So, move on na ta sa ato ang next procedure, okay? So, next, we will be doing some neutral warmth in order to inhibit muscle tone, decrease spasticity, and also to promote relaxation. We will be doing this for 5 minutes. So, sir, kanisha, sir, this will help with your spasticity, okay? So, yan na po. Together ka, sir. Yeah. Okay. So, we will be doing this for 5 minutes. Okay, so assuming that 5 minutes has done, so sir, mana ato ang 5 minutes, do you feel any kind of discomfort? Wala rin, no? Okay.
Next we will be doing is breathing exercises. This is to improve your ventilation, strengthen your respiratory muscles, and promote effective breathing. So first, we will be doing what we call the diaphragmatic breathing. This is to facilitate your diaphragmatic movement and increase your vital capacity. So what I want you to do is to place your one hand to your tummy and the other hand on your chest. So I want you to breathe in through your nose and then exhale slowly, okay? We will do this for 6 repetitions, 6 times. Okay? 1, 2, 3. Inhale through your nose. Do you feel your hand moving in your tummy? Okay, now I want you to exhale slowly through your mouth. Next is the first lift breathing. We will do this for 2 sets with 5 repetitions or 5 times with 5 seconds hold. This helps your airway to open longer so that you can have better exhalation or breathing out and breathing in or inhalation. Okay, so what I want you to do is you will inhale through your nose and then exhale in a pursed lip like this. Okay? Sige. 1, 2, 3. Inhale through your nose. And then exhale pursed lip. Next we will be doing, sir, is the assisted puffing. We will do this for 4 times in 1 set. So this will help you in promoting effective coughing. Okay? What I will be doing is that I will be applying pressure to your abdomen. Okay? So for the therapist, they should do an inward and upward pressure. Okay, so what I want you to do, sir, is I want you to inhale and then cough. Okay? Okay. 1, 2, 3. Inhale. Cough. Inhale. Cough.
So for PNF hold, relax, passive stretching exercises in supine and sitting for 10 minutes, this is to increase joint mobility, improve soft tissue extensibility, and decrease spasticity. So with cervical flexion, PNF, it's done with the patient in supine, with the head slightly off the edge of the bed here, but supported by the therapist. The therapist is positioned at the edge of the bed, position of the head of the patient, and then the hold relax technique utilizes the autogenic inhibition, whereas the agonist isometrically contracts and is resisted and is then placed in a new range and then relaxed. So the therapist passively flexes the head towards the body. So try to face your body there. Yeah, okay, good. So then, so keep that position. Okay. So then the patient holds that position and then the therapist applies pressure, pushing the head back into extension for 5 seconds. So hold that position, huh? I will push your head here, but you have to resist. Okay, ready? Hold that position. Resisting for 5, 4, 3, 2, 1. And then the therapist passively moves the head into a new range. So, and it's asked to relax. Okay. So that is repeated for 5 times for 5 seconds hold, with 5 seconds hold for 2 sets. Cervical rotation is done with the therapist passively moving the patient's cervical neck towards the left, to isometrically contract the right SEM, holding that position while the therapist actively places resistance towards the right from the left. So okay, I'll move your neck and your head towards the left, huh? Sige. Okay, keep that position. So I will put resistance from the left towards the right. So hold your head, huh? Okay, hold your neck in that position. So placing resistance. So don't let me push it towards the right. Good. Holding for 5 seconds, and then after is we move it to a new range, and then relax. Okay, so this is done for 5 repetitions for 5 seconds hold, 5 seconds hold for 2 sets. It's done in sitting with the therapist behind the patient. So for cervical lateral flexion, it's done the same with the therapist behind the patient, and the patient is in sitting position with a back press. So the therapist actively and the patient passively moves his neck towards the right. So bend your neck towards the right, huh? I'll bend it. Okay, bend it. Oop, are you nakatayo yan? Okay, then this isometrically contracts the left SEM. Holding that position, don't let me push your head back here, huh? So hold that position. So pushing, so resist yun. Okay, for 5 seconds, and then after 5, 4, 3, 2, 1, moving it into a new range, and then placing it back to neutral. So that is for cervical lateral flexion. It's elbow flexion. So it's done by passively moving the right elbow towards elbow flexion. So I'll bend this, huh? Sorry, nakato. Okay, now I'll make a fist. Okay. So holding this position with the autogenic inhibition, I will add resistance, putting the elbow into extension. So yun, hold that position, huh? While I place it down. So adding resistance for 5 seconds, 1, 2, 3, 4, 5. Then moving it into a newer range, and then relax. So done for 5 seconds with 5 seconds hold, 5 repetitions for 2 sets. That's for elbow flexion. For wrist radial deviation, I have the patient's right hand on my hand, and then I will passively move it towards the lateral side. So yun, just straighten your hand, straighten your palm. Okay, I will move it towards their thumb side. So there you go. Okay, good. Hold that position, huh? While I move this here. So don't let me move it there. Okay, ready? Placing it here, possibly placing it into wrist radial deviation. So adding resistance. Okay, so don't let me push it towards the other side. Adding resistance for 5 seconds, and then passively moving it to a new range, and then relax. So done. For the ulnar deviation, it's done the same, but towards the ulnar side. So palm straight. Okay. So this is the movement here, passively moving it toward ulnar deviation. There ako. Okay, hold that position, huh? While I move it towards here. Adding resistance, hold the position for 5 seconds. 1, 2, 3, 4, 5. Done. After it, I will passively move it into a new range. Then relax. So that is for wrist, ulnar, and radial deviation. It's done for 5 repetitions each, with 5 seconds hold, and done for 2 sets. The patient is sitting in front of the therapist. So yeah.
Some PNF, hold, relax, passive stretching. So these exercises will help you improve your joint mobility, increase your soft tissue extensibility, and also decrease the spasticity na sa imuhang muscles, especially sa imuhang lower legs. Okay? So that okay? Okay. So we'll be doing these exercises for 5 reps, 2 sets, and 5 seconds hold. Okay, so let's start, miss. Higda lang ta, miss. Is that baliktad? No. Hindi. Higda sa back. Okay, so right now, first, okay, we'll be stretching the knee flexors. Okay, so right now, miss, say yes lang. Say yes lang if you feel any stretch na, miss, ha? Okay, say yes if makafeel ka ang stretch. Yes! Okay, so now I want you to push your leg against my shoulder para mangahi imuhang muscles nila. Okay, 1, 2, 3, go. Hold this for 5 seconds. 1, 2, 3, 4, 5. Okay, relax. Now, further stretch ko, Miss, ha? Okay, say yes lang if maka-feel ka ang stretch.
Yes.
Okay, so, push against my shoulder again. 1, 2, 3, go. 1, 2, 3, 4, 5. So, now, okay, I want you to say yes again if maka-feel ka ang stretch. Miss, ha? Okay. So,
Yes.
okay, so right now, okay, push against my hand para mangahi mo ang muscles here. 1, 2, 3, go. Hold this for 5 seconds. 1, 2, 3, 4, 5. Okay, relax. Now, further stretch ko.
Yes.
Okay, so now, push against my hand para mangahi na ko yung muscles here. 1, 2, 3, go. 1, 2, 3, 4, 5. Okay, relax. Now, okay, other motion na sa tamisa.
Okay.
So, say yes lang gihapon if you feel any stretch. And then, 1, 2, 3, go.
Yes.
Yes, okay. So, right now, okay, I want you to push against my hand para mangahi mo muscles here. 1, 2, 3, go. Hold this for 5 seconds. 1. Okay, relax. Now, further stretch go.
Yes.
Okay, so, again, same thing ra. Push against my hand para mangahin mo muscles here. 1, 2, 3, go. 1, 2, 3, 4, 5. Okay, relax. So, here na po tamis ha. Say yes lang gihapon if you feel any stretch, okay?
Yes.
Okay, so right now, I want you to push against my hand here, my palm, para mangahi imuhang muscles dito, okay?
Okay.
1, 2, 3, go. 1, 2, 3, 4, 5. Now relax. Okay, stretch. Okay, now push against my hand. 1, 2, 3, go. 1, 2, 3, 4, 5. Okay, relax. Other side na tamis. So, stretch.
Yes.
Okay, so now, push against my hand din here para mangahi mo ang muscles here, okay? 1, 2, 3, go. 1, 1, 2, 3, go. 1, 2, 3, 4, 5. Okay. Further stretch ko, miss ha? 1, 2, 3, go. Feel?
Yes.
Okay, now, push against my hand here para mangahi muscles here. 1, 2, 3, go. 1, 2, 3, 4. So
So today, ma'am, we're gonna perform different set of exercises in order to help improve your condition. So the first thing that we're gonna do is chin tuck exercise. So this exercise will be performed for 10 repetitions and 1 set, ma'am. So this chin tuck exercise, ma'am, this will help in strengthening your neck muscles in order to help improve your forward head posture. So the what we're gonna do here, ma'am, I want you to press your head down to your pillow, ma'am. Mangusog ka sa pillow, ma'am, and then stay in that position for a few seconds, then relax ta, ma'am, ha. Then we will do it again, and then relax, then do it again, ma'am. Okay? Sige, ma'am. Let's try, ma'am. Push your head down sa pillow. Okay? Say relax, ma'am. Sige, again, ma'am. Press. Relax. Okay. So the next exercise that we're gonna perform, ma'am, is range of motion exercises. So we'll do this actively. So these exercises will help in maintaining your joint mobility and also prepare for fine and enhance your fine motor skills. So the first exercise that we're gonna focus on is the wrist and hand exercises. So here, ma'am, you'll be performing wrist flexion and extension with your hands closed and hands open. So here, ma'am, your hand on the table with your palm facing up. So I want you to, what we're gonna do later, ma'am, I want you to make a closed fist while bending your wrist, ma'am. like that. Then after that, ma'am, you bend it backward, then you open your fist. Okay? So we'll be doing this for 5 repetitions and 1 set, ma'am, ha? Sige, I want you to do it, ma'am. On 3, 1, 2, 3. Close fist, bend. Okay, then down, open. Okay, again, ma'am, close fist, flex. Open fist, extend. Again, ma'am. Okay, close. The next exercise that I'll be performing, ma'am, is hand stroking. So I'll be stroking the dorsum part of your hand, or the back part, and I'll be just putting my hand here on your fingers. So here, ma'am, I'll be stroking your hand here in order to stimulate the extensors, the muscles of your wrist and your hand. So I'll be doing this for 5 repetitions and 1 set. The next exercise that we're gonna do, ma'am, is hand waving. So hand waving from left to right. So we'll be doing this first on your right side, then on your left side. This is to stimulate your muscles, and also to increase the mobility of your joint. So the first thing that you're gonna do, ma'am, is I want you to spread your fingers apart, ma'am. Spread them, and then move them. You will do radial deviation. So radial deviation, ma'am, means you will move your hand towards your thumb. Okay? So while you move it to your thumb, you spread your fingers. And after that, ma'am, you'll move it towards your pinky. And your fingers, ma'am, will be close together. Okay? So again, ma'am, spread your fingers when you move your hand to your thumb, then close your fingers, and you move it to your pinky. Okay, so I want you to do it on your own, ma'am. Okay, 1, 2, 3. Okay, to your pinky. Okay, to your thumb, ma'am. To your pinky.
We'll be doing a range of motion exercises. So before that, I want you to sit properly. Straighten your back. Straighten your neck. Okay. So assuming there's a mirror in front of us. So sir, I want you to look at the mirror, sir, and check yourself if straight ka ba yung posture. Keep your back straight and roll your shoulders out. First, we will be starting with our seated marching exercises. I want you to raise your thigh and your knee up towards the ceiling. Okay? The other side. Okay, so alternate foot, sir, ha? So raise your thigh up towards the ceiling. Alternate foot. Okay. So do it again. Okay, taas pa. Other side. Okay. 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 Now we will be doing the knee flexion and extension exercise. First, I want you to straighten your knee. Is that all you can do, sir? Okay. Other leg. Okay, other leg. Okay, other leg. Okay, other side. Okay, other side. Okay. Next would be a heel slide. So now I want you to move your right foot away from the chair. So towards there. Then, isa lang, 1 foot lang sa. Then towards the chair. Towards the chair. Sige. Palayo, other side. Then back towards the chair. Other side na side. Sige, back towards the chair. Sige. Balik, sir. Okay. Other side. Okay, other side. Okay, other side. Okay, very good. Now we will be doing the heel raises. I want you to point your toes up towards the ceiling and then back flat to the floor. Point your toes up, okay? Down, up, down, up, down again, up, down. Other side, up, down, up, down, up, down. Very good. Next would be toe raises. Now, I want you to point your toes. Point your, usa lang sa kasan. Point your toes. Sige, towards the floor. Then flat din sa ground. Point your toes, then flat sa ground. Okay, back. Point your toes, back. Tigas. Toes. Point your toes, back. Point your toes, back. Point your toes,
Back, very good.
This exercise, I will be introducing you to an aerobic exercise using the device called a recumbent stationary bike. So, nakagabike pero galing ka sandig ka na. So, sabot naman. Okay, so in this, we'll try to improve your aerobic capacity, improve your muscle strength, minimize the effects of atrophy, and increase resistance to fatigue. So in this exercise, we will be maintaining a moderate intensity for you, ma'am. And this is done during Mondays. Okay? And so, we will do this for 15 minutes or as tolerated. And so, before we start, as mentioned, atong iset na og moderate intensity. So, santig lang kadiha ma'am, no, ana. And then, I'll be here in this position to guard you if anything happens. So, ingala ko ma'am if anything happens, unexpected happens, or naala kay, if you're feeling something, or if you're feeling pain, na masakitan ka, ingala ko. Nalipong ka, ingala ko. Okay? So, start. Mura ka gabay. Wait lang. So, assuming 15 minutes is done, so ano na? Okay ka ma'am? Sa pag-bike niyo, okay ra? Dahil automatic na lain. Okay, so, that would be all for this exercise. So, move on to the next. And so, for this next aerobic exercise, I will introduce you to the arm-leg ergometer. So, in this device, uses the motions of your arms and legs into improving your muscle strength, aerobic capacity, minimize the effects of atrophy, and increase the resistance to fatigue. So, as before, we'll set to the minimum or moderate intensity or resistance. So, ang button one is to put your arms here and your legs there. Sige daw. So, mura ka gabay and mura ka ga. Sige na. Okay? Dapat ra? Okay, so, we will do this for 15 minutes. And once I say start, you may start. And tell me lang if something goes wrong. Okay? So, start. Okay? Okay. Okay, so stop na ma'am. So, assuming 15 minutes have passed. So, ask ko ma'am, okay rin pamati ma'am. Okay? Pag buhat niyo, okay ra? Wala ko. Okay. So this exercise we will do on a Friday, and the stationary bike will be on a Monday. Okay?
Independent mobility exercise in about 10 minutes with therapist supervision and audio cues, and therapists could really assess specifically their movement in the upper extremity. So first off would be side to side. So the patient will be going to the right, assuming I'm the patient and I'm also instructing the patient. Okay, so sir, I want you to move your right, and first I want you to bend your knees. Make sure that your feet are flat on the bed, and try to raise your body pushing off your feet. Then try to move your right arm away from your body to make space, and move your right leg towards the right. Then move your left leg towards the right. Then lower your butt. Okay, sir. And reposition yourself, or realign yourself to the new reposition body. Then do the same movement again, such that you would be able to reach your desired position. Okay, carefully, sir. And the same goes when going to the left side, but the difference is that it is on the left side. This would be upward and downward movement on the bed. So first off, going to the head of the bed, which would be upward movement. Okay, sir, I want you to bend your knees. Make sure your feet flat on the bed. Then raise your butt. Then try to move towards the head of the bed by pushing with your head and your back shoulders, and pushing with your legs. Then lower your butt and then reposition your legs such that it'll be closer to your butt, and do the movement again. Slowly, sir. Slowly, slowly. Okay, sir. Okay. Then now, sir, we're going downwards. So again, bend your knees again, flat, feet flat on the bed. Then raise your butt off the bed. Then try to move downwards by pushing on the back of your head, back of your shoulders, and your feet. Then try to lower your butt again, then reposition your feet, then do the same movement again, such that you'll be able to reach towards the foot of the bed. Supine lying position to long sitting position. So, sir, I want you to move from supine, or from lying on your back, to long sitting position, but first move towards the side first. So move towards your left this time. So I want you to cross your right leg over your left leg, then cross your right arm over your body, such that it'll be beside your left arm. Then move towards your left, so that you'll be lying on your left shoulder. Then try to raise yourself with your extremity. Slowly, I will just assist you, sir, with this, considering contractures, and try to realign yourself and do or move to long sitting position. So the same movement would be done in the opposite direction, from long sitting position to supine lying position. Supine lying position to prone position. First off, ask the patient to move to the sideline position, to the left this time for sideline position for easy reference. So, sir, I want you to place your right arm over your hand so that your left shoulder will be beside your left ear, and try to cross your right leg over your left leg, sir. Then try to cross your right arm over your body. Then try to move to your left shoulder so that you would lie on it. Then now move on your tummy, or continue moving so that you'll be lying on your tummy. Then as you do that, make sure your right arm, or it would be starting to go away from under your body, so that it will not be crushed, and realign yourself so that you'll be in a prone lying position. So the opposite would be done from prone lying position to supine lying position. Be supine position to side lying position. So I would be moving to the left this time. Okay, so sir, I want you to move to your left so that you would be lying on your left shoulder. So can you cross your right leg over your left leg, and try to cross your right arm over your body. And then now,
Continue moving such that you'll be lying on your left side. And reposition your arms so that you'll be comfortable. So the same thing goes when moving to the right side lying position. Prone on elbows. So assuming the patient is already in the prone lying position, since supine to prone have been done already. Okay. So sir, I want you to carry your body with your elbows when you do that, sir. Okay, I'm just going to assist you, sir, considering you can't really do that much on your own with available strength you have. So I want you to bend your elbows. Okay, carefully, sir. Carefully. And I want you to, as much as you can, carry your weight with using your elbows and try to reposition. So can you position, sir? Move your elbows forward since it's like you would be having difficulty. Okay, and try to straighten your back as much as possible. Okay, so I'm just going to assist you. Okay, so this would be prone on elbows. X would be bridging. Okay, so sir, I want you to bend your knees. Make sure your feet will be flat on the surface of the bed, and then try to raise your butt off the floor by pushing your feet towards the bed. Okay, slowly, slowly. Okay, okay, sir, that's it. So in bed mobility, this is helpful in positioning. So make sure that once the patient moves from one position to another, make sure that there would be 2 minutes interval or more, so that the effect of pressure relieving technique would be very effective.
So karon sir, atong buhaton magbuhat ta og coordinate balance nga exercises sir ha, para ma-improve ang imong balance paglingkod and the stability sa imong trunk or sa imong kanang body gyud. Okay? So atong buhaton sir kay weight shift exercise. So ang atong buhaton is mo reach ra ka sa imong side. So reach ka sa imong right, then mo reach ka sa imong left. So buhaton ta ni 5 times each side sir ha. So 5 sa left, then 5 sa right. Okay? So sige sir, let me see you perform daw. Sige, ana lang, sit up straight. Sige, 5 reach ka left 5 times. Pikas kani left. Ready, set. Sige, go. Okay. 1. Sige. 2. Okay. 3. Okay. 4. Okay. 5. Okay, sige, rest na sir, rest ka diot. Sige, now we proceed na to your right side. Okay, so i-move na to gamay mo ang chair. Sige, right side, reach, ready? Sige, go. Okay. 1. Sige, kuan gyud, ana jud ka 1. Sige, 2, ana. Sige. 3. Okay. Sige, 4. Okay. Sige. 5. Okay. Proceed ta coordination nga exercises sir ha. So ang atong buhaton kay ball passing o ball dribbling. Okay sir, so buhaton ta ni 5 times nya 2 sets. Okay? So this is for us to improve for you to improve sa imong balance and imong control sa imong lawas. Okay? Nya when I ask you to catch the ball o ika-dribble sa ball unya, tanawa sir ha. Tanawa ang bola ha. Sige. Start na ta sir. Ready? 1 2 3 go. Sige, catch. Okay, tanawa sir. Okay. Sige again. Catch yan, tanawa. Okay. Tungan na sir, ini ka-catch, tanaw diyon. Okay, very good. Okay, 4. Okay, very good. Sige, 5. Okay, sige, rest ka diyon sir, rest ka diyon. Relax, breathe sa breathe. Sige, balik ka sir, ready? 1 2 3 go. Okay, very good. Okay. Okay, very good. Okay, 3. Okay, very good. 4. Okay, very good sir. Last. Okay, very good. Karon sir, mo proceed ta dribbling na sad sa ball sir ha. So 5 sa imong right, then 5 sa imong left. Okay? Sige. Right na sir, right. Sige. So lean ka forward. Lean forward niya. Sige, dribble the ball 5 times. 1 2 3 4 5. Sige, rest rest. Okay, proceed ta sa left side nimo. Ready? 1 2 3 4 5. Okay, very good sir. Thank you very much sir. Proceed ta sa sunod nga exercise. Thank you sir.
Hi sir, so for the last exercise we'll be doing your balance training. Okay, so first of all, I will be putting this mid belt or safety belt so that I will have something to hold on in case you lose your balance during our transfer will be you're sitting to standing. So since you're in your wheelchair, I'll be using your wheelchair. Okay, first step sir, I want you to move over the edge of the seat. Move over sir. Okay, very good. And then I want you to move away your footrest so that your feet will be touching the ground. Okay sir, perform. Okay, faster sir. Okay, very good. So this time your foot isn't touching the ground. So I want you to put your arms towards the armrest. Get here sir, yes. And then magbarog the sir. So magbango, 1 2 3, and then I want you to push using your hands to the armrest. And then try to bring your body upward. I will be here. So I'll beat you with bounces of floor. And then confident sir. Okay now. Okay. 1 2 3. Up. 3 4 3. 1 2 3. Down. Hold again. Is your standing and will transfer. So while standing, I want you, we will be moving into this bed. So same, and then if motor mo tahan, same ka here. Okay, sir? Same procedure na. Okay. Okay. Hands on the armrest, sir. Okay. One, two, three, up, enter, and then one, two, three, now touch the bed. Okay, very good. So, balik na dito sa aming wheelchair, sir. So, kaya niyo, sir? Okay. 1, 2, 3, push, and then hold your armrest. Down. Okay. Nice one, sir. Your wheelchair to the bed using a sliding board. So, firstly, sir, I want you to move your wheelchair at the 45-degree angle beside the bed. So, move, sir. Assuming that this is a 45-degree angle, next, sir, I want you to clear your footrest, move your footrest away. Then, that armrest, this left side armrest, I want you to pull that up. So, this is your transfer board or your sliding board. So, I want you to lean over towards your right side. Okay, so I'll insert this, sir, and then sit on it. Okay, sir, reminders before moving, I don't want you to put your arms beneath or fingers beneath your sliding board so that you will not be pinched. Okay, sit, sir. Okay, so this time, sir, I will, the count of 1, 2, 3, up, 3, and then we will slide this board towards the bed. Okay, sir? Yeah. Okay, are you ready, sir? Okay, you can put your arms here. Okay, 1, 2, 3. Okay, very good, sir. So after you remove sliding board. So that is your wheelchair to bed transfers. This time we'll be doing opposite, so bed to wheelchair. So same position, sliding board here. Get your body there, sir. Put down the sliding board. Slide towards your wheelchair. Okay. 1, 2, 3, slide. Okay, very good, sir. That's a nice job in transferring. Okay. So for the next wheelchair transfer, wheelchair to floor. So for our next wheelchair exercise, we're doing wheelchair to floor exercise and floor to wheelchair. Okay. Move forward. And then copy the wrist. Arms up. Up, up, three. I want you to push your body up and then let your knees touch the floor. Okay. 1, 2, 3, up. Yes. Keep your hands. Then good. That is your forward transfer. From that area, or we go to chair. So I want you to bend your legs. Your knees pointing the way. Like this. Hold the other. Hands on the one, two, pick up on your knees and fully from there. I want you to squat to the back. That is our core and floor here. I would also like to teach you another exercise. So we're doing wheelchair propulsion training. So first is wheelchair propulsion on even and even surface. So I presume that you already know how to propel your wheelchair now. So where will you place your hands on the rim? Okay. Then lean back. After, go to propel on your own. For the second one, roll your wheelchair. So aside from this, backward descent from a ramp, one curve. So the second one is your backward descending a curve. Okay, so forget about this. So you can manually propel backwards, zero, backward. So stop na sa end here. So I want you to lean forward, sir, and then you put it kasama na po ang back wheels. Okay, sir? 1, 2, 3. Okay, so nakasakar ni, and then ano sa kinanami sa curve. So the next part is your entering and exiting through a doorway. So sir, you mentioned that your doors in your house can swing too, so swing towards you. Okay, so we'll be using this door, same as in your house. So I want you to move your wheelchair at a 45 angle against the opening of the door. So nakagaling sa door natin. Move ang wheelchair, sir. Okay. Then I want you to lean forward to open the door now. Then, okay. And then move, propel na ka inside. Go, go, go. Go, go, go. Pull this.
So this time, sir, we'll be entering our swing away door. So, opposite sa kanina, I want you to position your wheelchair 45 degrees facing the opening of the door. So, yung loop, yung kanina yung wheelchair, kaya nasa side sa kaning hinge. Okay, sir? Okay, hold ka, sir. Okay, sir. Okay, this time, I want you to open the knob. And then pull, push, and then move. Enter the door. Step up it. And then close.
Chair training will be your ascending and descending a slope or a ramp. Okay, sir? So we have two techniques, using the 4 wheels or using the 2 wheels. So first is your 4 wheels. This is the regular one. We're in example that is an ascending ramp. And you can also assist me, sir, by pushing your wheels faster. 1, 2, 3. Okay. So we are moving. So the other one, sir, is the 2 wheels. So I will be tilting you backward. papel na may upward. Next one is your ascending and backward position. Okay, the backward position. So, para dili magtagap ang ato patient, so I will be tilting back. You will maneuver. Okay? Then go upward. That's it. And for descending the stairs, or for descending a ramp or a slope using a wheelchair, we can perform a backward maneuver. So from here, example, this is the patient is in the top and down. We'll be using the four-wheel maneuver and then slowly. Pwede na mag-move sa imong concert push and then imong ikuan i-brake slowly ang atong brake. Okay? Go down. Go down. Oh.
Sa mga exercises diri ma'am sa therapy kay dadun po na siya dito sa balay kay makatabang man ni siya sa pagkuan kondisyon ni sir, especially aning ankle pumps ma'am.
I will teach you how to do the ankle pump, so you can do this at home, okay? So first, I want you to pull your toes up towards you. Only one first, so use your right foot first, and then towards me. Towards you again, then towards me. Okay, the other foot towards you, and towards me. Okay, again towards you, then towards me. Okay, very good.
Bugol ang dugo ni sir diri sa yahang bitiis, mga hill slides, toe races, marag gitudlo man nako si sir, and if makakita ka ma'am, breathing exercises para makatarong sa mood ni sir o ma-strengthen yung muscles diri na panginhawa o bed mobility katong sa higdaanan para makalingkod siya when higda makabarog makaadto sa kilid sa bed o kaning kuan mga fine motor exercises para sa iyang kamot para makalihok siya mga sa iyang wrist ug hand. Karon ma'am, kanang tudloan niya ti ka ma'am kung on the proper way of kanang exercising, bali proper posture, mga proper body mechanics niya. Kaning sa kuan ma'am, wheelchair ma'am, sige gitag kuan na ni ma'am every 30 minutes ma'am. Sige kag exercise si sir, sige exercise marag isa kaniyang lubot ma'am, patakilid, ingana every 30 minutes gina siya ma'am. Nya katong sa bed ma'am, dili gina siya mag-stay og usa ka posisyon, dapat mo takilid gina siya or dili ka mag-ubo. Every 2 hours gyud ka mag-ilis ana ma'am ha. Ya karon mama throughout the course of the therapy ingnan man gyud ka unsa gidagan sa kondisyon ni sir o unsay mga i-expect gid ninyo panalain na mga kuan sintomas sa ALS. Karon anang ikaw mama sa significant other ko sa balay imo gina siyang asison alalayon sa iyahang mga buhatonon sa balay, especially kaon, igligo ma'am kay ang imong support ug imong pagpangga kang sir kay mo gini makatabang niya sa course sa therapy gid ma'am. Ya kuan ma'am, input ka na within i-observe po na mo diri sa therapy o i-observe po ninyo ma'am na higit pala biya nag-exercise si sir kay daligin na sila makapoy. So kita patuyang pabugat sa mga pangpakusog, di po ta patuyang og kanang pagrabis exercise niya. If sakit ta gani muundang kita sa tong exercise ma'am ha. Nya syempre katong exercise sa katong isa lubot ug ilis position makatabang gito siya to prevent contracture ma'am. Ang kanang contracture balik mo ni manggahi na imong joints ma'am kay wani giluhog og dugay. So sa sige og kanang lihok-lihok ma'am katong dala atong home exercises program ma-prevent kito nang ining contracture and also pressure ulcers katong balhin-balhin position ya. Human kay kanang diri sa kanang may exercise si sir kay magamit may gate belt para kung mahulog siya masaw ano na mo siya dayon kay murang bitaro ng belt o ya sunod kay kanang every time na mag-therapy ma'am para maganado og lihok si sir ako mo siya inon gaana mo siya cues mo man sige go sir kani sir mo ni ang himuon gayda na mo siya kanunay ma'am. And even ikaw ma'am if may exercise kay mas makagali makag-catch up or gets ni sir, so we will be teaching you para ikuha niya imong pag nabalay tudluan nimo siya dali na siya kuha imong manggaydan. Okay ma'am, so that would be all. This is the copy of the kanang akong ipangyayaw ganiha mga patient education na mga kuan o family education na mga tips, mga kuan katong home exercise program o mga precautions or mga kuan mga dapat nimo hinumduman while nag-exercise si sir o while within nag-therapy si sir. Okay ma'am, thank you good kayo ma'am sa pagsalig sa mo ma'am.